My name is Sean Veenendaal. I'm a physician assistant in orthopedic surgery at Froedtert and the Medical College of Wisconsin. I've held that role since 2011. My education is from the University of Wisconsin-Madison. I graduated with honors with a degree in physician assistant studies in the year 2011. The type of patients that I usually see, frankly, they can be all ages. They generally fall into two categories for me. Our practice is split between joint replacement and orthopedic oncology. So the majority of the joint patients that I see are typically between 40 and anywhere up to 80 or sometimes even 90 years old, but frankly they can be any age. The other part of our practice is oncology. That means tumors of any type, benign or malignant. Those patients can be any age, anywhere in the span of life. In my practice, I would say the majority of the patients that I see are joint replacement candidates. The thing that I really focus on in my practice is to work on options for non-operative management of joint conditions. So injections, medications, therapies, things like that that don't necessarily involve surgery. Aches and pains in a joint don't always require joint replacement, and so my goal is to try and explore everything that we can from a non-operative perspective prior to diving into surgery. My practice philosophy, I really try to listen to patients and hear their story. Everybody has a unique story, and I really try to tune into that and understand where they're coming from and work together to find some solutions to their problems. Whether that means surgery or non-surgery, I really try to partner with them and understand where they're coming from. The thing that I probably enjoy the most in patient care is patient education. I think it really is one of the most important pieces in the whole thing. I think patients really want to understand what the problem is, what the solution's going to look like, what happens in the operating room, what they can expect in recovery, and I feel that that education piece really helps them know what's going on and ultimately have a successful outcome. The team approach that we use in the oncology portion of our practice is multidisciplinary. Every Wednesday morning we meet with a group of radiologists, other orthopedic surgeons, radiation oncologists, and people from all different disciplines to discuss individual cases and really come up with, as a team, with the best plan of care for each individual patient. When I'm outside of the office, I probably spend the vast majority of my time with my family. I'm married, I've got 3 kids. They are perpetually in sports year-round. I probably spend the majority of my nights at some sort of sporting event. When I'm not doing those things, I probably spend the remainder of that time doing woodworking.